Okay, well, my name is Mark Caputo. I reside in Murray, Utah. I've been coming to see Amy at A&J Bodyworks for about 3 months now. I brought her a body that was totally wrecked, 57 years of abuse, and it's hard for me to explain what she's done for me, but I can tell you what she is doing works.
Cool.
Yeah.
Tell us a little bit about what we have done.
Well, I first came in, I was having severe gastric problems from medicines that were prescribed for me that were not for the malady that I had. I decided to drop the medicines and go a different direction, but I just couldn't get over the gastric problems I was having. She did a little lymphatic drainage, which was my first session, which, lack of a better word, was unusual. It was a different experience, different from what I was expecting. I didn't know that kind of light touch and what she was doing to me was actually affecting me as much as it was. The first session was, lack of a better word, remarkable. It was, and I use the word crazy a lot. It was just a crazy experience, and it was an enjoyable experience also. We scheduled another appointment later, about a week later. We did a CranioSacral treatment. Again, I usually do research into things that affect my body and what people are going to do to my body, and I went into it kind of blind, and I just put my faith in her and what she could do for me. And again, what an unbelievable experience. Unbelievable. And again, the word crazy comes up. I get up off the table, and it's just hard to explain. But I knew that I was being helped, and that's the key word. I was being helped. I was going to a regular physician, and I would leave his office feeling nothing. Just throw medications at me, and that wasn't working. The medications actually make me sick, physically sick, and since then I've dropped all but one medication, and it still makes me sick, but and that's for blood pressure. And I will meter my blood pressure tonight after I'm through with this session, and without being on any BP medicine for the last 24 hours, my BP will be unbelievably low. So there's something to it.
Where did we start out with BP?
209 over 180. Stroke. I've had 2 strokes.
Now average is looking at?
We're 128 over 90-ish. And that's with medicine too. So yep. Half and half. And I'll give you half credit for that. I will.
There's a place for medicine for sure.
There is, but the synthetic poison that man comes up with, it has its good, it has its bad too, but I think it's mostly bad. I think if there's a different way of dealing with things, then I think this is the way I want to go. I like this a lot better than being sick.
So GI issues, what else have we worked on?
Well, some of the side effects of the medicines that I were on were motor nerve damage, well, inflammation, I should say, occipital nerve damage, or inflammation, sorry, and olfactory nerve inflammation. And they described that as Bell's palsy. And I contracted Bell's palsy on the 30th of June, and I had a session with Amy on July 1st or 2nd, I don't know, Monday. Bell's palsy is a very uncomfortable, it's terrible. She, and making no promises to me or anything, she just said, let me work on this for you. And she did a little CranioSacral therapy with me, and within 15 to 20 minutes, my face was coming back, my ability to blink came back, a little bit of my motor nerve in my face and jaw came back. It's a terrible, I don't even know if it's a disease. It's just a terrible thing. Lack of a better word, it just feels like somebody punches you in the face 25 hours a day and there's no relief from it. They tried to give you a steroid, and the steroids wouldn't work for me. They give you a prescription for basically shingles, chicken pox, herpes, and again, makes me sick. It was terrible. A few sessions with Amy, we were getting it corrected. It's unbelievable. Within the first treatment, though, I felt relief. I still have a little bit of it because I sleep on my face, but I know people that have had this for almost a year. A colleague, I ran into him. I looked at his face. I said, dude, what happened to your face? And he said, I got Bell's palsy. And I went, I'm not making any promises, but I know somebody who can take care of this for you. And he came and saw Amy, and he was very satisfied with the results. You guys were amazing. I was having problems with my pancreas. Well, I got a lot of problems. I'm just a laundry list full of broken down things, and they probably don't have enough tape for this, but I'm just saying that there's some things that she can do, manipulating your nervous system or the bones in your head or just my pancreas. I came in to one session. I have a strenuous job. I do a lot of heavy lifting. I do a lot of physical labor, and I could barely make it through that day. And I came in, and I had my girlfriend bring me because this is on the way to the hospital. I told my girlfriend, if this doesn't work, if Amy can't help me tonight, take me to the hospital, and I want surgery. I just want it out. You remember that night?
Mm-hmm. Absolutely. Pain level of 8.
Yeah. Yeah, I was in severe pain. I mean, hard to breathe, rapid breathing.
Very uncomfortable on the table.
Oh boy, yeah. Yeah, it was hard to work on. I don't know if I was in a fetal position or not, if I laid straight. I was I was to a pain level that I thought I was going to black out. It was that bad. Mm-hmm. And again, within 30 minutes or so, I mean, she worked the 5 zones on my back and neck and head, and by the time she got to the 3rd zone, my breathing had gone back to a normal rate, and the pain was subsiding. Yeah, I still had pain, but not like I did. Again, here comes the word crazy. It was just crazy.
We're just excited to see good results with it.
And this is the thing. I do see results when I come. I look forward to coming. It's just one intense. I don't really have the words for it, and I usually can.
So A1C 4 months ago.
They diagnosed me with type 2 diabetes in April. I'm not a diabetic, even though I do have the markers for diabetes. My glucose levels are, well, that day were terrible. I went to the hospital, the emergency room, with a 452 on my glucose level. My A1C that day was 13.9.
And today?
As of last week, my glucose level, my glucose levels are down, but my A1C went from 13.9 to 6.6 in, what, 3 months? 3 months since May.
I'm so
And
glad you're improving.
my medical doctor asked me what I was doing, and I told him I don't take the diabetes medicine. That's what was making me sick and was the reason for the initial visit with Amy. And thank God, sort of, that that medicine was making me ill. But I do not take any diabetic medicine at all. Again, she made no claims that she was going to help me with that. It just seemed to be a bonus. She did help me with my pancreas, which is responsible for the diabetes, but I think we're actually kicking that, and I feel very much better, unbelievably better.
Thanks so much, Mark. We appreciate you doing
Oh
this.
yeah, there's nothing. I mean, I don't do this. I don't do this at all. But I see people trying to help people, and how can you not? I mean, they honestly help people. They help me.